Hello and welcome to season 5 of Forever Young. I'm your host, David C. Linton, and it's a pleasure to be with you today on this exciting day. It's always exciting. I hope you all have been staying safe while we've been away. You know, we're still in this pandemic, and while we're getting closer to normal, we're still not there yet. So we still encourage you to mask up, and if you haven't got your vax, please think about it. You know, this is the show that says you're forever young. And we believe that life begins at 40. So if you're 55, you're really only 15. And if you're 65, you're only 25. Because you know what? This is the show that says age ain't nothing but a number. I'm joined by my two lovely co-hosts, and I couldn't do the show without them. We call her Beautiful, and we're glad that she's still beautiful and she's back for season 5. That's the lovely Miss Jean Hendricks. Hello, Jean.
Hi, David. I am delighted to be here. I have missed this so much, but I have enjoyed the time, and I'm looking forward to our guests and our questions and answers today. Back to you,
Well,
David.
it's glad to have you, and you're still looking beautiful.
Yes,
And
I.
of course, we call her the glue. She keeps us all together. Um, that is Dr. Sharon Mitchell. She's other co-host and one of our producers. She kind of helps get this show together, and we don't say enough or much about how she has kept us together for these 5 seasons. So, welcome, Dr. Mitchell.
Thank you, David. Always a pleasure to be with you and Miss Jean, and we're excited to be with our audience again. Glad to see you all again.
Well, it's been a pleasure. Like we said, this is season 5, and so much has happened since we started Hope TV, which has been the vision of our pastor, Dr. E. Dewey Smith, and Benton Aladdin and his media team, who's pulled this all together. We got to give a shout out to our producer, Cami Tappan, who's always making sure that we're on point as we get ready for the show. But well, you know, we're starting the show off in October, and you know, October is a very important month. It is Breast Cancer Awareness Month. And so we thought no better way to kick off this show by bringing you some information. And when we bring you information, we always have experts. But before I get to our expert, we have to start off in our tradition, and that's Jean. She has a little tidbit that I'm sure she wants to share with us. What's that golden nugget you have for us today?
Yes, I do, David. And this one is written by Mary Ann, and it simply says, "The beast crept up inside of me. I stared it in the eye. I cried and prayed, and I fought back. I beat it. I survived cancer." Back to you, David.
Well, thank you, Jean. That was apropos as always. Well, let's get to our guest today. She is the state executive director of the Susan Komen Breast Cancer Foundation here in Georgia. She's responsible for leading and overseeing all community development initiatives in the Peach State in pursuit of fulfilling Komen's vision of a world without breast cancer. She is a graduate of Hampton University. She's a pirate, that's HBCU. She's also involved with St. Jude's Children's Research Hospital and UNCF, United Negro College Fund. She's a member of Alpha Kappa Alpha Sorority, the Atlanta Business League, and was recently chosen by Atlanta Magazine as one of the most powerful leaders in our city. And so, without further ado, I'd like to welcome to Forever Young, Miss Sierra McCann. Welcome, Sierra.
Thank you so much for having me. I am excited to be here.
Well, we're excited to have you, and you're just lighting up the screen. And for all of our male viewers, I know you envy me.
Well, I'm
Well,
single, so call me.
Well, you know, as we
Yes.
said, this is we like to have fun, but you know, obviously our subject matter today is quite serious. Something that we all probably know someone who's been affected by breast cancer, and we've all heard of Susan B. Komen, Atlanta. So why don't you tell our audience what is the mission and the vision of Susan B. Komen Atlanta?
Yeah, so simply put, our vision is a world without breast cancer. We work
Mm,
tirelessly within the communities to help find cures, to invest in research, to provide screening services for uninsured and underinsured women and men. And I say
mm,
and men because oftentimes
mhm,
people think that men cannot get breast cancer, but they can. And
mhm,
so we advocate for them as well. But overall, our goal is simply to create a world without breast cancer.
mhm.
Wow,
Do
that's
you,
great.
Sierra, do you have a target audience here in Atlanta, the Susan B. Komen? Do you have a target area that you work with?
We do. So, surprisingly enough, oftentimes when people think about Komen, when I'm out in the community,
Mhm,
they think of it as an organization that only caters to white women. And I don't
mhm,
know where
mm,
this comes
mhm,
from or why people think that. But my number one priority is creating health equity for Black women, and that is the number one goal of Komen nationally as well.
mhm,
When we look at statistics, Black women are dying from breast cancer at a rate that is 40% higher than white women. And so
mhm.
we know that if
Wow.
we are going to help with mortality rates, if we're going to close this gap, then our focus needs to be on the women who really, really need our help, and that is Black women.
Mhm.
Oh, wow.
Yeah.
Sierra,
Mhm.
we're glad you're talking about the focus itself. So, are your goals in terms of your national goals, are they the same locally, or do you have different approaches, local versus national?
So they're pretty much the same because Atlanta is Atlanta and there are lots of us here. Our
Mhm.
priority has always been Black women. And on a national level, we've kind of shifted some because, our researchers and our executive leadership team came together again and we're like, how do we move the needle forward? Since 1989, we've been able to decrease breast cancer mortality rates by about 40%. But how do we keep those numbers, what do we do, who needs our help the most? And so we have created what we call an African American health equity team, and we've recently launched an initiative called Stand for Her. It's a health equity revolution, and that is our priority, focusing on Black women all across the country.
Mhm. Wow.
Okay.
Sierra, excuse
Excellent.
me
So,
for 1 second. Did I hear you say that there were more African American women with breast cancer? Did you say that?
So we are dying from breast
Right.
cancer at a higher
Wow.
rate than white
Great.
women. So nationally, it's at about a 40% increase. And then locally in Atlanta, it's 45%. So it's even higher
Wow.
here. And that is why it has always been our priority.
Thank you.
Yeah.
that's
Yeah.
interesting. A correlation is is similar with the with African American men, and when it comes to prostate cancer, it just seems
Yeah.
that with us, it's
Mhm.
the getting the word out and working on prevention is so key.
What's up, y'all? It's your boy Jermaine Dolly, Mr. Hello Dolly himself. And guess what? You're tuned in to Tea and Worship with my homies, Mignon and Corey. Keep it locked, y'all.
Hey y'all, it's Candy West, and you're watching Tea and Worship with Mignon and Corey.
It's your boy James Fortune, and you are watching my favorite news show, Tea and Worship, with my sis Mignon and Corey.
R. Kelly, is he muted or canceled for you?
I'm not canceling TP2.com because that's my joint. I'm not going to be able to do it.
Look, we're going to get all in there today. Going back to church. Are you ready to get in the house or are you ready to stay online?
I don't want to catch COVID. I'm ready, but I want to be safe.
Burnout in 2021, do you feel it?
I am going, not trying to get burnt out because I understand how it is. If you Dodge there tomorrow, your job description is going to be on somebody's Indeed.
So tell us about your role as the state executive director of the Susan B. Komen. I mean, how long have you served in the role, and give us a look at your day to day, or how. Just break down that role. It sounds like a lot of responsibility.
Oh, it is. But it is an awesome position with an awesome organization with an amazing purpose and mission. So I am blessed, very, very, very blessed to have this position. But in this role, I oversee all of the community develop initiatives. So essentially, I am a fundraiser. So I am the person who is knocking down doors, talking to people, talking to them about our mission, the work that we do in order to get funding that will provide screening mammograms, diagnostic services. It goes to our patient care helpline. So I am the person responsible for finding money to help us get women screened, essentially. I've been with the company for about 2 years now. And so our service area has changed a little bit. Before COVID, we only serviced the 13 counties here in Metro Atlanta. And now we service the entire state of Georgia, which is really, really great because before we were only servicing areas that had a Komen office. So in Georgia, that was Savannah and then Atlanta. But what we recognized is that obviously women all across the state need our help, right? And so women in West Georgia were not being able to be serviced. They weren't getting their screening mammograms. We weren't funding them. And so now that we have kind of revamped, we've kind of looked at what the community really needs. And so we've made those changes and we now cover the entire state. So no matter where you are, you can receive service and support from Komen.
Well, a quick follow-up to that. You said fundraising. So you're in charge of fundraising. So is Susan B. Komen, is that a nonprofit?
Yes, we are a nonprofit organization and have been so since 1982. And we are proud to say that about 88 cents of every dollar goes directly towards the mission. And that includes investments into research and then also to our patient care services that provide direct support for men and women in treatment and who have been recently diagnosed.
Okay, great.
Okay.
Good. I think you've already answered my next question. I understand that that advocacy is a part of your organization. Can you share who you are advocating for in other target areas?
So we advocate for all women, all men who are experiencing this diagnosis. And so what some of that advocacy work looks like, we are actually on Capitol Hill. We're reaching out to our senators. We're talking to policymakers because things that we sometimes don't think about, but are extremely important to the breast cancer community often go overlooked. And so one thing that we have been advocating for is for those who have been diagnosed with breast cancer or metastatic breast cancer, which is stage 4 and it's metastasized and spread to other areas of the body. But we advocate for them because they need to be able to get disability, Medicaid, almost immediately to help cover the cost of their treatment. And so the way that things currently are, they cannot automatically get funding or support. So they're waiting oftentimes 6 months to a year in order to get support, and that is unacceptable. And so Komen really is just advocating for these men and women to make policy changes, even in states, just with working with your health insurance companies. And these are things that people don't think about when they think about Komen, but we are here on the ground in every capacity advocating for men and women.
Well, before Dr. Mitchell asks the next question, I wanted to zone in on one of your something you said, which is real key. You said men, because a lot of men don't realize, and people don't realize, that men too can get breast cancer. John, Richard Roundtree, who played Shaft for you old schoolers, was one of the first men that I'd heard of that had breast cancer. So can you just give us a little bit for that segment of our audience who may think, well, this is just a woman's thing.
Right.
And the crazy thing about it is that while it's only about 1% of men who are diagnosed with breast cancer, most times it's a late stage diagnosis because men are not thinking something's going on, I got breast cancer. Right. So that is not their first thought. Maybe there's a soreness or a lump or something going on. But again, everybody is equating breast cancer to something that women get. And so men tend to wait to go to the doctor. And then by the time they go, it is a stage 4 diagnosis, which we know is there's no cure for, or no treatment, or limited treatment options.
Well, men are just stubborn about going to the doctor, period.
Yes.
Right. Right.
Yes. So then especially if you add in something like, a lump, you're like, oh no, that ain't breast cancer. That's nothing. But, we tell men too, looking for the same signs, if there's a lump, if there's a hardening of the skin, if there's a change in nipple color, go to the doctor because it very well could be breast cancer.
Wow. So Sierra, you're talking about cancer overall, and we did want to give our audience a little bit of background. David mentioned prostate cancer, and we obviously are talking about breast cancer, but can you just talk about cancer overall in terms of what the diagnosis typically is, the prognosis, and what potential recoveries? You just talked about stage 4, for example, breast cancer. So can you give us just a little background on cancer itself?
Okay, I will try my best.
Okay.
But I kind of want to touch on this too, since David did mention prostate cancer, and it's something that I think that we oftentimes don't think about too. The importance of knowing your family history, because we have done the research, and what we have seen is that if your father had prostate cancer, then that increases the likelihood of the daughter having breast cancer.
Wow.
And so just knowing, knowing that information is extremely important. So that's number one. Just want to put that out there to make sure that I didn't forget to mention that. Knowing your family history is extremely important. And if your father has had prostate cancer, then that increases your risk and your likelihood of getting breast cancer yourself. So that's number one. And then 2, when we talk about the stages of cancer, there's stage 1, 2, 3, and then 4. So 4 is the most advanced stage of cancer. And for us, as far as breast cancer is concerned, I briefly mentioned it, but we call that metastatic breast cancer. And so that is cancer that has metastasized. It may have spread to the lungs, to the brain. And what we focus on as far as treatment is just extending your life. So life extension, because there is no cure. But oftentimes it's terrible. But oftentimes they're telling, women, you've got about 2 years when you are stage 4. And I have met women who have lived for 5, 10, 15 years with this. And it's because they are closely following their treatment regimens.
Freedom. It's at the core of who we are. The freedom to live without fear, to jog where we please, to wear a hoodie. The freedom to breathe. Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until Black lives matter.
And this is kind of off topic, but something that is extremely important when we're talking about people who have been diagnosed with stage 4 are your clinical trials, right? So these are so important. And oftentimes Black people are not participating in the clinical trials. And so because of that, we have limited data. And so it's extremely important, especially for those who have that stage 4 diagnosis, that Black people are participating so that we can know how it's interacting with our body chemistry, our cells, and all of that, so that we can eventually find a cure. There's a young lady, she is my absolute favorite. I adore her. She was diagnosed at 28 years old. And she is now 33 years old. She got diagnosed with stage 4 breast cancer. And she's been participating in clinical trials. And right now, her breast cancer is in remission. Like, there is absolutely no trace of it. And so I just wanted to share that, because that just goes to show how important these clinical trials are when, to people who really need the help. So I think I got off topic a little bit, but
no, you didn't. Actually, you did not get off topic. You actually went to my next question, and I'm so glad you said that, because my follow-up to whatever you may have said was, I was going to talk about the clinical trials, because even my prostate cancer, I'm a survivor, so I speak. Stage 1, caught it early, and because I caught it early, didn't have to do extensive radiation or anything like that, or any surgery, but was able to cure it. But I donated my tissue to Emory for clinical studies, because they approached me, and I know that we don't, as I was going through the process, just knowing that we as a group of people, African Americans, don't participate in those studies.
Yeah, right.
And so the reason that, so I thought it was important. So when you mentioned that, you just, you was right in my wheelhouse. And it was part of my next question, because that's why, it's important for us to participate, do the preventive, but even donating to that, because if they don't have the kind of data, because, the human body is similar, but there are certain things that are germane to ethnic groups, family history, as you talked about, because you just blew my mind when you said about the prostate cancer affecting
with daughters.
That, I think that was the whole show, in terms of if anybody didn't walk away with anything new, that was a real revelation. So I know that we talked about that. So Jean, I know you have the next question, because like I said, she went into my next question, which was really good though. It was very on point, and that's how we have these conversations. They're just so conversational, and it just flows like that. So Jean.
I think Miss Jean may be frozen a little bit.
Frozen. She may be frozen. Go ahead. Go ahead.
You talked about cancer as it relates to breast cancer. How do we look as it relates to overall cancers as it relates to African Americans?
So it's about the same. So as far as, it is. So as far as like diagnosis, again, I really can only speak about breast cancer, but the rates are about 14% for African Americans, and I think that is pretty standard across the board. So we are within the top group or ethnic group that is diagnosed with cancer, and so it's something that we need to be very mindful of.
So tell us, how are you doing as a service professional in terms of COVID? How has that affected, you and what you do? And, because it's really interesting because everybody's been focused on COVID, but people are still having heart attacks. People are still having
Mhm.
cancer. So how has that affected um,
Yeah.
your role and even messaging during this period of time?
That is a great question. And so I can talk about this in kind of two ways, right? So let's talk about it from an operational standpoint with Komen first. We have completely changed the way that we do business. Prior to COVID, we were in an office, we had office space, we were in Buckhead spending a lot of money for rent. If we're being
Yes.
honest.
Mhm.
Um, so we have kind of revamped and we are all working from home remotely, henceforth forevermore. There is no office space throughout the entire organization. So the great
Wow.
thing about it is, yeah, there's no headquarters. We are all in our homes. But it makes complete and total sense because now the money that we were spending on rent is going
Mhm.
directly to the mission. So this is
Mhm.
something, I mean, it's mind blowing, all of the things that you didn't think about before COVID, even,
Mhm.
meeting with people, we're
Mhm.
going out, meeting people face to face when we could have been having these amazing virtual meetings and reaching people in different areas of the country and kind of bringing them on board to support. So it has totally changed the way that we do business. And then from like the patient side of things, when COVID first hit, we were telling women to delay their screenings. And so that was the guidance that we gave them for, I would say, at least 6 months or
Mhm.
so. And that guidance was correct. That is what came from the CDC.
Mhm.
However, on the back end, look at all of these people who delayed their screening and may now have a stage 4 diagnosis as opposed to
Yeah.
catching it in an early stage. And so I think it's the National Institute of Health, but they've estimated that there will be upwards of 10 to 20,000 additional deaths simply because of the guidance to delay screening and people being unable to get tested in a timely fashion. So that is going to we'll probably start seeing the effects of it within the next year or two, but we know that delaying screenings is going to have a negative effect for many people across
Mhm.
the country.
Wow, that's
Wow.
that's uh, that's it's
Yeah.
interesting, and it's
Yeah.
what I'm looking at the time, and our time is about what's almost. There's so much
So let's
information.
get good. Right.
You've been a great guest, and if I can just, and I know our audience, and there's so much more we want to impart and share. Can I impose upon you to come back with us next week to share more information about
I
this
guess so.
program?
I
Oh, you
guess I would love to.
okay. And again, well, before we do that, because again, we have been talking with Sierra McCann from the Susan B. Komen Foundation of Atlanta. Um, how can people get in contact with you? How can they get more information? I know they're going to be back next week if you come back, but just in case they don't, how can they get in contact with you?
Just in case they don't come back, people
Mhm.
can visit our website. It is komen.org/Georgia. We have information regarding screening services, guides to help you know your risk. So anything that you need to know, you can go to that site to learn, and that's komen.org/Georgia.
Well, thank you so much. You've been such an informative guest. Jean, thank you
Yes.
for always being here. And Dr. Mitchell, I'd like to thank
Mhm.
our producer, our associate producer, Cami Tappan, who's back there making sure that we stay on schedule. And I'd like to thank you for joining us all this week on Forever Young. Remember, October is Breast Cancer Awareness Month. You can go to the Susan B. Komen /Atlanta website, as Ms. McCann just told us, so that you can get more information. And just remember, life is nothing but a number, and you're forever young. On behalf of our executive producer, Dr. E. Dewey Smith Jr., and Benson Aladdin, and the entire Hope TV staff, I'm David Clinton. See you next time. Good night.